Brigham Young University, that's in Provo, Utah.
All right, thank you and good morning. Just as was mentioned, my name is Tyler Brennan and I'm an undergraduate student at Brigham Young University. And this is actually my first conference, so I'm really excited to be here. I have had the opportunity the last semester to work on a team of undergraduate researchers where we are studying and digitally mapping the maxillary division of the trigeminal nerve. And our major goal for this project was really just to identify any variations or patterns that might exist in the maxillary nerve branches. And we wanted to do that for two main reasons. The first reason is just to inform the improvement of primary learning so that we could understand these variations better and also help other students to understand them. The second reason was so that we could inform the improvement of any clinical procedures that might involve the maxillary nerve branches, specifically in dentistry. For example, when dentists need to anesthetize maxillary teeth in order to work on a patient, that can often be a difficult procedure and require more than one shot because those maxillary nerves are difficult to pinpoint. And I know that for me, if I was this patient, I definitely wouldn't want to get that shot more than once. And so we wanted to see if there were any patterns or variations that might make this a little bit easier or a little bit more comfortable. So to get started with what we know of the anatomy, I'm just going to use the mouse to kind of point on here. We've split our project up into three separate parts, and hopefully you were able to see the posters of the other two portions of our project just previous to this. One portion of our project focuses on the superior alveolar nerves that innervate the maxillary teeth. One portion focuses on the greater and lesser palatine nerves that extend inferiorly from the Pterygopalatine Ganglion, which is pictured here, and innervate the palate. And then my portion of our project focuses on the Pterygopalatine Ganglion and how it is intersected by the Vidian nerve. And the Vidian nerve is actually comprised of two separate nerves, the greater petrosal and deep petrosal nerves. The greater petrosal nerve carries parasympathetic branches, and the deep petrosal nerve carries sympathetic branches. And these two nerves combine together posteriorly to the Pterygopalatine Ganglion, and then extend through the pterygoid canal here, and intersect the Pterygopalatine Ganglion as one nerve fiber. And just so that we can see that better on a cadaver, we can see our Vidian nerve here that the arrow and the probe are pointing to. And we can also see the Pterygopalatine Ganglion right there. And the Vidian nerve just extends into that as one nerve fiber. And so that's what we were expecting to see. So in order to carry out this research, we obtained 10 cadaveric head specimens, pictured on the right, that were then dissected and carefully microscribed to create some digital models that we could compare, so that we could compare specimen to specimen and identify any patterns or variations. In order to dissect these heads, we started with first hemisecting them down the midline, and then we focused on removing all of the skin tissue, fat tissue, and muscle tissues that were necessary to isolate our nerves. We also had to remove the nasal mucosa and break through the sphenoid bone in order to expose the Pterygopalatine Ganglion and the Vidian nerve. But once those nerves were identified, and we completely dissected each specimen, we were able to microscribe them using a digital 3D rhino microscribe that's pictured here. And this was actually a really interesting process. We were able to take each of our specimens and establish an X, Y, and Z plane that the microscribe and the computer would recognize. And then we interpolated thousands of points as we traced across all the bony structures and outlined the nerves to make a rough three-dimensional model on the computer. And then we were able to use the Rhino 3D surfacing techniques to create our final product that's pictured in the top right corner. And this was really helpful for our research because we were able to highlight each of the nerve branches that we were interested in different colors, so that we could, and then we could focus in on one color and compare across the different specimens. One really interesting variation that we found can actually be seen if we zoom in on the sphenoid sinus right here, and we have our pterygopalatine ganglion just like we expected to see. But in this specimen, we actually don't see a Vidian nerve at all. Instead, we see the greater petrosal and the deep petrosal nerves. And they stay separate and then intersect the pterygopalatine ganglion independently. And they don't form a Vidian nerve. As we compared that with our digital models, we were able to see it even more clearly. In the figure on the left, you can see the pterygopalatine ganglion as this red bundle of nerves with just a single Vidian nerve extending posteriorly from it. And in the image on the right, you can see our variation, where the pterygopalatine ganglion actually has the greater and deep petrosal nerves intersecting it independently. And just as a side-by-side comparison of the cadavers, we can see, again, a pretty stark contrast, a pretty significant difference in these images and in this variation. As far as the statistical frequency for our research, when we dissected each of our heads, we obtained 2 specimens from each head because we hemisected them. And so far in our project, we've been able to complete a total of 5 heads, which gives us 10 total specimens. So we thought it would be fun to take this really good looking head and hemisect it just like we did on our project, and use it as just a representation of the statistical frequency of this variation. And so the green dot indicates that we observed a variation where there was no Vidian nerve, and the red dot indicates that we didn't observe a variation. And it was really interesting. We found that in one of our heads, we found a unilateral variation where it was just on one side. In most of our heads, it was bilateral, and in one of our heads, we didn't find a variation at all. And so that gave us a total of 7 out of 10 of our specimens that had this variation, which is a pretty high frequency. As far as the clinical implications for our research, it really comes down to increased accuracy in distinguishing between the sympathetic and the parasympathetic nerve bundles that pass through the pterygopalatine ganglion. Specifically with patients that might have chronic vasomotor rhinitis, which is a chronic runny nose that's not due to a common cold or allergies. Sometimes doctors will recommend an endoscopic Vidian neurectomy, which I took a screenshot of here, where a surgeon will use a transsphenoidal approach to break through the sphenoid bone and access the pterygopalatine ganglion so that they can damage or remove the Vidian nerve and stop the parasympathetic response of producing mucus. And so if a patient had this variation, it would be important for a surgeon to know that so that they could specifically target the greater petrosal nerve and not be forced to damage both the parasympathetic and the sympathetic nerves. And so kind of the next step for our project would be to identify effective ways to find this variation in patients. One way that we thought of is by using CT scans and recognizing if there are multiple foramens that the nerves pass through posteriorly to the pterygopalatine ganglion, or just one, in which case there would be a Vidian nerve. But the other authors and I would just sincerely like to thank those individuals who donated their bodies and tissues for the advancement of our research, and also the Brigham Young University College of Life Sciences Startup Grant. Thank you.
Thank you. Excellent talk. Any questions for Tyler? What are your plans for your 3D model?
So for the 3D models, we're able to kind of separate out the nerves, because sometimes on the cadavers they're hard to see because there's so many of them bunched together. And so for the 3D model, we want to kind of just use that to continue to compare them from specimen to specimen so that we can see any variations.
You put a lot of work into it. Would you like to share it with other institutions?
Yes, definitely.
Also, I think this is a great explanation for why it's frustrating in the cadaver lab. Many times you don't find the nerve.
Brennan?
Very good presentation, excellent.
Thank
I have
you.
a question for you. When you are microscribing and you're going along the surface, when you have something that's very small in diameter, the probes they have a point on them, but do you find you're running over the edges of the nerve at that point?
Yeah, we were still able to get right on the nerve. You mean with the point of the microscope? Yeah, it was small enough that we were still able to pinpoint them and run over them in detail.
So did you get diameters on the branches?
I don't think that we specifically got all the diameters. We tried to do the best we could, but that might be something with the next 5 heads that we do that we could focus on more.
All right. Thank you, Tyler.
Yeah, thank you.